Around the world, about 2.3 billion people still do not have access to basic sanitation facilities. They have no clean, private, or sanitary places to go when it's time to go. Whereas the privileged can enjoy privacy and take their time on their so-called ceramic thrones, many of the poor are forced to defecate in the open, public spaces such as fields, streets, and even open bodies of water. About 70 million Indonesians practice open defecation.
The practice of open defecation is dangerous. Poor sanitation is linked to the transmission of diseases such as cholera, diarrhea, dysentery, hepatitis A, typhoid, and polio. Pathogens from expelled fecal matter often find their way into food and drinking water, causing the onset of diseases previously mentioned. We have estimated that inadequate sanitation is the cause for 280,000 diarrheal deaths annually. The sad thing about this situation is that diarrhea remains a major killer, but is 100% preventable. Better water, sanitation, and hygiene can prevent the deaths of 361,000 children under 5 years old each year.
Each year in Indonesia, there are around 50,000 deaths and 120 million illnesses attributed to poor sanitation practices and inadequate facilities. A devastating crisis is occurring in Indonesia. Projects have been attempted, but the efforts often fail to prompt the level of behavior change to generate health gains. Efforts to construct hygienic latrines were particularly criticized for exacerbating social inequalities.
The poorest were getting left behind as the wealthier households benefited from the government's subsidies for toilet construction.
In order to decrease these disparities, the Total Sanitation Program was introduced. This project aimed to develop an effective strategy to change behavior, increase the market of the sanitation facilities, and involve the community in a total sanitation campaign. When this program was initiated, sanitation in urban centers was 70% and only 55% in rural communities. In order to receive support for total sanitation and sanitation facilities, discussions were held with government officials and community leaders about the disparities that can result from poor sanitation and the amount of money that can be saved from having total sanitation.
To increase the demand for improved sanitation, we used a community-led sanitation method. This model focused on changing community behavior rather than individual behaviors. It was important for communities to understand that even if only one person is defecating in the open, it can lead to disease. Our communities were able to develop their own plan in order to achieve total sanitation. First, it was important to map out the community boundaries and designate where people can participate in open defecation. It was also crucial that we used marketing techniques in order to increase the demand for sanitation services and products. Our program included advertisements of positive hygienic behaviors. One of the communication campaigns included an unhygienic character named Lick Telek, which translates to Uncle Shit. Uncle Shit would defecate in the open regardless of other people's advice to use sanitation facilities. Thankfully, the district funded the campaign, which included a video drama, posters, and radio commercials.
Market research was done to better understand sanitation facilities.
It was found that defecating in the water was ideal and even considered safe in these communities because the poop was washed away. There was also varying opinions of what an ideal sanitation facility was, which gave the impression to people in the community that they were too expensive.
The project then worked with sanitation facility providers and designers to develop a common definition of ideal sanitation, but with varying options and prices. The sanitation facilities were marked in order to show that they met the improved sanitation criteria.
Provided a training and accreditation program developed at an institute in East Geneva. As of 2009, 600 workers in 10 districts were trained and graduated from this program. This ensures that every community and village has a trained sanitation worker. This community-led program resulted in a 49% increase in access to improved sanitation within 18 months in comparison to other programs that only led to 10 to 15% increases. More than 325,000 people in East Geneva gained access to improved sanitation facilities within 2 years.
Forward to 2017, Indonesia is experiencing rapid urbanization. Challenges come with high rates of urbanization. One of those problems will still surround open defecation and sanitation and managing its facilities. 76% of the urban population already have proper toilets, but the problems persist. One of the problems are due to dumping of septic tanks onto rivers, causing heavily polluted rivers across Indonesia. Open defecation is also still a problem because other populations don't have access to sanitary stations or toilets.
We want to implement septic tanks as it helps to decrease the total amount of defecation. With on-site sanitation, the government will focus on fecal management and to construct treatment facilities to better enhance overall sanitation for the well-being of our people.
Indigenous groups are promoting safe sanitation across the country through community-based practices. However, many express concerns about some of the program's tactics, such as shaming individuals who practice open defecation. This can be an ethical issue as it is demeaning and disrupts an individual for a better cause. Water scarcity, poor water quality, and inadequate sanitation negatively impact food security, livelihood choices, and educational opportunities for poor families across the world. To improve sanitation and access to drinking water, there needs to be increased investment in management of freshwater ecosystems and sanitation facilities on a local level. In several developing countries within sub-Saharan Africa, Central Asia, Southern Asia, Eastern Asia, and Southeastern Asia by the year 2030.